Okay, so I have verified my orders. I have made sure that I have everything I need for this IV insertion. I made sure that nothing is expired, nothing is already open, and I will now enter my patient's room. Hello, I'm Nick. I'll be your nurse today. What's your name and date of birth?
Ivy Armstrong, March 1964.
All right. Do you have any allergies, Miss Ivy?
Latex.
All right. I have no latex with me today, so that'll be all good. Let me take my gloves on, and then we can get started. We're going to be doing an IV insertion, and so that way we can replenish your fluids, because you have been throwing up. All right, let's go ahead and get started.
All right, Miss Ivy, we're going to go ahead and get IV administered.
Okay, Miss Ivy, do you have any history of fistulas, have a mastectomy or a skin graft?
Skin
No.
graft or mastectomy?
All right.
No.
Attention's over here. I know you guys are filming. When we do chairs, please pick them up and move them because that giant scrunch, it makes it really hard for us to hear your video. So please just pick up chairs. Tell your other people to pick up chairs, please.
Okay, so good, no fistula,
so
mastectomy, or skin graft.
I'm going to
We've got some blood.
find the veins. So I found a nice vein right here. Let me put
Get my
my
stuff prepared.
We should have taken that off a while ago.
All right, this is going to be our tourniquet.
let me add this, put this
Some
tourniquet
blood
on.
flow. I'm gonna go ahead and try and find the vein, okay?
Alright. We got a nice vein right here. Okay, blood's ready.
Side, we'll be able to see swelling. How's everything feeling?
Looks like a
Alright,
good
so I'm going to
vein.
start
We'll go
off
ahead
by
and use this one.
taking this J tube,
I'm gonna go ahead and clean for 30 seconds.
cleaning for 30 seconds. So, 2, 3, 6, 9, 10, 11, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25,
Make sure
26,
that
27,
we've got good
28, 29, 30. Okay.
and then we're
I'm
gonna
gonna hold this while
Alright, while that's
I
drying,
can
I'm
get
just trying to
this
put my other
got some blood back in there.
materials.
Now we're just gonna flush
normal
it.
saline prepped. So I'm going to attach
Let Jay lick.
that
We have
here.
easy access. Give Miss Ivy her medication.
I'm going to prime it. Good to go. I'm going to put this cap back on.
Okay,
I'm going to set it to the side while I get everything else ready.
tie
This
this
is my friend Kaya. Thank you. Kaya, my other nurse.
So I have
Even though my phone is trapped, it's still not.
my sharp right here. I got my
Want me to count
needle.
down or just go ahead? Want me to count down or
And I
just
will
go
take the
ahead?
cap off.
Go ahead.
Make sure I have
It's on its feet.
I'm
just
gonna
checking
pull
your
down
thing
here
here.
so I have
And I'm going to take
hot vein.
my chlorhexidine wipe. And scrub for 30 seconds.
Push my catheter all the way. Pull that back.
5, 6, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22,
push a little
23,
bit of
24,
saline.
25, 26, 20, 29, 30. So I'll then take my needle, I'm going bevel sides up. As I take here, I'm going to pull back.
And then aspirate. I see some good blood flow. And I'm gonna push this saline, okay?
Alright, I got my flashback. I'm going
Alright, keep pushing.
Lower the angle.
We're gonna lock this for
to push in a little bit more. I'm going to take my catheter here, move my needle,
I'm gonna go ahead and put this on.
place that in the sharps container. Going to use some tape to keep this here in place. While I then take my tube of normal saline, take this off, and attach that to the catheter. And I will then push about 10 milliliters of normal saline, and then I will clamp it to create a positive pressure as I push. All right.
Alright, we're just gonna go ahead and set that right here.
All right.
How's
Now
it
that I have
feeling?
that, I'm going to
Good,
disconnect
good, alright. Then right
this,
here,
hold my hub up,
the
as
dates
I
and my
then take
initials.
this,
Make sure everything's feeling good.
clean
and
everything
dispose
up just
of
to make
this
sure
one.
everything's a bit dry so that my
Get my
bandage will
materials
stick.
back out of the way, and then you should be good
Alright,
to go.
so then what I'm going to do is I'm going to take this and put this bandage on here.
Okay, so you're good. You just have to find and doing all this crap.
Take this. Tape it so I have a good view of that pole.
That's fine.
Alright. So I'm going to take this here and create a J, my tubing.
You need me to count 1, 2, 3? I'll go 10 to 15 repeats.
Alright, and then I'm going to take this here and record the time, date, and my initials. And put that right above the insertion site. I'll release the tourniquet. And here we go. Ivy, do you need anything else today?
No, thank you.
Alright, I'll be back. Check on you later.